All right, so in this video, I want to explain to you what periodontal disease is or what gum disease is, and essentially where it starts from, how to treat it, and what to expect after treatment. So I hope you'll like it. So essentially, gum disease is a disease of the support tissue around the tooth where the tooth loses the bony support, as you could see in this area here, right next to the neck of the tooth where the bone gets lost but also pockets starts to form. When pockets starts to form, an oral rinse such as a Listerine rinse or tooth brushing or dental flossing cannot go deeper than 1 millimeter from that pocket depth. So when you have a pocket depth more than a couple of millimeters, all the regular cleanings that you receive at home will not be sufficient to clean the bacteria that lives in these pockets and create destruction of the gum tissue, the bone, and eventually could lead to bone loss and tooth loss. So this essentially translates into patients who have bleedy gums. This could be in the anterior zone, but most likely it will be in the anterior as well as in the posterior zones, where when patients clean their teeth, they will bleed. Sometimes the bleeding happens even without any cleaning, which is indicative of disease. When we see a close up of the gum tissue, we see how the gum tissue is angry, it looks red, and sometimes there is purulence, there is pus coming out of these pockets that could never be cleaned at home and require a professional treatment instead. So, how does this work really when we notice that a patient has bleeding? We have to do a full assessment of the case to find out what best treatment we should use for the patient. As you see, sometimes patients present with bleeding, sometimes they present with bleeding, but also with recession of the gum tissue, because when the bone gets lost, the gum tissue will recede down, and that will expose the roots of the surface of the teeth and leads to generalized recession or localized recession depending on your case. But all of this is coming because bacteria is living in these pockets and can never be treated just through regular cleaning at home or flossing at home. It has to be treated professionally by reduction of this pocket that is too deep, making it just normal pocket, which does not harbor as many bacteria and does not lead to gum disease. This, you could say, bacteria is the main reason why this disease happens, but it's really a very complicated disease that essentially has multiple components that are leading to why some individuals are hypersensitive to bacteria and inflammation and end up destroying their own bone and their own tissue in the presence of inflammation, and why other patients with the same bacteria do not respond just as aggressively by not destroying their tissue and their bone. Remember, there is a genetic component to gum disease. A lot of times it runs in the family. So if you have gum disease, perhaps your parents had also some version of that gum disease, and perhaps your kids may have also some version of gum disease. When left untreated, if you don't do anything, gum disease has that bacteria that's living within the pockets that very e- readily and very easily migrate through the bloodstream into the cardiovascular system and migrate to the heart, migrate to the brain. New research is showing that patients with gum disease are at higher risk of cardiovascular disease, heart disease, but also Alzheimer's disease because the bacteria migrates in the bloodstream and goes into the heart and lives there, or go into the brain and lives there. So it's a very big problem if we don't pick up on this issue early on, because not only you will lose your teeth, but also in the meantime, you will harm your heart and you will harm your health in general, but also your brain. So how do we really confirm the severity of gum disease and how do we treat it? We always start with a general picture of the teeth that we take at every new visit with a patient to see how much generally how much of a bone loss there is around the teeth and how much remaining bone there is around the teeth. As you can see in this picture, there is an amount of bone loss that is around few teeth that need immediate attention. This case is a very severe gum disease case, but this picture doesn't show us in depth the amount of gum disease around each tooth. A lot of times, most times, the standard of care is to take a full mouth series. This is a number of x-rays that we need to take that essentially look much closer at how much bone there is around the teeth. And once we do that, we confirm the amount of bone loss that we see on the x-ray with what we call a periodontal probing. This is the probing that happens around the teeth to see that, to confirm that what we see on the x-ray is also what we see in the mouth through this periodontal probing. Once we determine all of this, now we are ready to do an assessment of how much bone loss there is, where the bone loss is, and what the treatment may be in terms of correcting for this issue. So I'll show you here if you really don't do anything, not only we discuss the migration of bacteria into the bloodstream, which is a very bad issue, but also ultimately you will get to a stage where your teeth start moving because they lost so much bone that these teeth are not stable anymore in the mouth. A lot of patients come to the office and they say, my teeth are shifting, they are bleeding, and that is a very clear indicator that they may have gum disease that needs to be treated on time. So, how do we treat gum disease? Well, it really all depends on the severity and the location of the gum disease. As we spoke before, the regular cleaning at home will not be helpful. You need to clean at home, but you also need to receive professional treatment. Part of it is non surgical, and the other part is surgical treatment, unfortunately. If the pocket is not very, very deep, we can use a procedure called scaling and root planning, which essentially is a ultrasonic cleaning around the teeth deep into the pocket. If the pocket is not very deep, not more than 5 millimeters, we can, with scaling and root planning, be as efficient in killing the bacteria and reducing the pocket depth, which means that we're reducing the number of bacteria that live in the spaces into these pockets, which then allow us to maintain your teeth for as long as possible. A lot of times, if the pocket is also not very deep, we may elect to inject a local antibiotic that sits into that pocket and kills the bacteria over time. It takes 2 weeks for that antibiotic to take its full effect. And once we inject it into the pocket, we let it sit there and it will act by killing the bacteria and allowing the tissue to heal very nicely. However, a lot of times the destruction is so deep that even the antibiotic will not be completely helpful, in which case we decide that perhaps surgery may be an answer. And if we have tremendous amount of bone loss, if we have bacteria within the surface of the teeth and bacteria within the bone itself, then we may select surgery. The surgery is called pocket reduction surgery because it reduces the pockets around the teeth. So the goal of therapy is to go and open the gum tissue, access the teeth, access the roots, but also access a portion of the bone. The cleaning will be a mechanical cleaning, but also a chemical cleaning using cleansing solutions in the area to kill the bacteria and to remove all of the calcified plaque and all of the calcified food and all of the calcified bacteria that live on the root surface of the teeth, but also they live within the bone itself. So after we clean the teeth and after we clean the bone if necessary, we're going to go ahead and stitch the area closed. And once we stitch it, these stitches most times are resorbable, so we don't need to take them out. They will resorb on their own. And then usually within 2 weeks, you should be able to come back for a visit to see how you are actually healing. And I'll tell you now what to expect after the gum disease treatment. As you see in this picture, the patient presented with gum gum disease, and after the treatment, they have healthy gums. So remember, when we do the gum disease treatment, we are reducing the pockets, but a lot of times patients come a little too late and they have already recession in the area, which means that this recession that is sometimes aesthetically is not very pleasant will always remain there. In fact, a lot of patients who receive gum disease treatment to reduce the pockets also end up with what we call black triangles, which are those small little spots, black spots in between the teeth where the inflamed gum tissue was, but now it's very healthy, but it's reduced. So patients sometimes end up with a solution that is very good for their teeth, but sometimes not very aesthetic because they have developed black triangles. And unfortunately, this side effect, which is in a way a bad side effect to therapy, is actually very good for the teeth because it reduces the pocket depth and allows the teeth to maintain their bone and to maintain their support system for as long as possible. So, how to maintain the results after the procedure? Well, the very first thing you want to do is continue brushing your teeth very, very well at every spot of your mouth. Also, use tooth floss to clean in between the teeth all of the food that can get stuck in between that cannot be cleaned with a toothbrush alone. I'm going to introduce you to Waterpick, which is essentially a water flosser that cleans the in between the teeth. You need to buy the family size, which is the big size Waterpick, and also mix hydrogen peroxide 3%, half a cup of hydrogen peroxide, 3%, inside that container that you're going to use daily in the morning before you go to school or to work, and at night before you go to bed. The way you're going to use it is by going in between the teeth at the gum line and cleaning all of these bacteria using the water pick, water and hydrogen peroxide together, so that the bacteria never has a chance to grow more than necessary. Compare gum disease and periodontal disease to acne. If you don't wash your face every day and use an antimicrobial cream on your face, the bacteria will grow, and once it grows, you will have that pimple. So even if you wash after the pimple has appeared, you will still have that pimple that has to go through the inflammatory process cycle and then ultimately resolve. But as you see, prevention is much better than cure. Now, beside all of this home care, you also need professional teeth cleaning that happens usually every 3 months. In patients with gum disease, they need a deep cleaning every 3 months. This cleaning is called maintenance therapy. This is the therapy that allows you to maintain the results that you obtained for as long as possible and limits the loss of bone and tissue after you received your surgery. Now, how to manage resisting spots. A lot of times we have resistant spots that do not respond to therapy. And when they don't respond to therapy, these are the spots that still have deep pockets, they still have bacteria, and they still have some inflammation and some bleeding. So to treat these, we have different modalities and different options. One of them is an antibiotic that you need to take every day for 6 months. This antibiotic is called Periostat doxycycline, and this pill that you take every day for 6 months will act by allowing your tissue to remain firm and not to be degraded easily by the bacteria. The only two downsides of this antibiotic is that it makes you hypersensitive to the sun. So every time you essentially go to the sun, you have to be protected by eyewear, a hat, and a sunscreen. But also, every time you take this antibiotic, you need to avoid any milk products or dairy products because calcium does not allow the product to be absorbed by your body. So you can take these dairy products 2 hours before or 2 hours after you take the antibiotics. Now, alternatively to the oral medication that you're going to take for 6 months, I may elect to use a local antibiotic called Arestin, which is made pretty much of the same family of antibiotic, but it's a local microsphere antibiotic that goes right into the pocket that's resistant and sits in that pocket for 15 days. And when we use this therapy, it is local, so you don't have to worry about exposure to the sun and you don't have to worry about dairy products, but it will work for the most part, but we have to do a reassessment in 3 months to see if the pockets are resolving well or if you need additional local antibiotic therapy. The advantage of this antibiotic is that those microspheres, they attach to the tissue and they start acting by killing the bacteria over time, over a period of 15 days. And that allows the tissue enough time to heal. And once it's healed, there is little space for the bacteria to grow. And that essentially what turns your gum disease into healthy gums after all of this therapy has taken place and after you are receiving the maintenance therapy that allows you to maintain your teeth and to maintain your gum tissue for as long as possible and ultimately maintain your oral health and your smile for as long as possible. I hope this video was helpful. If you have any questions, please ask me when we do our consultations and we'll be able to take it from there. Thank you and we'll speak soon.